Surgeons, what patient came in such a horrific state, you hope they would die? A teenage girl was taking a nap at home one afternoon. As she slept, a reckless driver crashed into her house. Her father, who was in the kitchen, died at the scene. The crash caused an electrical fire, which ignited a ruptured gas line from the crash and set the entire house ablaze. She makes it out, along with her sister, but goes back in to try and rescue her dad and dogs. She doesn't come back out. Fire team drags her out. 95% of her total body surface area is covered in second and third degree burns. She has a smoke inhalation injury, lungs are fried, carbon monoxide poisoning, toxic inhalation, and cyanide poisoning. It was a goddamn miracle she even made it to the hospital. She survives the initial presentation to the trauma unit and now she's in our burn unit. Fun fact, what they don't tell you on TV is that true third degree burns don't hurt. The fire destroys the nerve endings. First and second degree burns are, however, exquisitely painful. She had mostly third degree burns but enough second degree that she was in agony despite a near constant morphine drip. It was a mess. The only intact skin on her body was a small area around her genitals and inner thigh. Her hair, face, lips, were all gone. Even her eyelids burned so badly they fell off in the ED, causing several nurses, techs and residents to vomit. We do what we can with moist sterile dressings and debridement plus broad-spectrum antibiotics. She looks like a mummy fully wrapped by the end. There is no chance of her having a normal life ever again. The chances of her surviving are in the single digits. We are silent but we all think the same thing. We secretly hope that she dies sooner rather than having to suffer for weeks or months. We hate ourselves for it. We hate the God that would do such a thing to an innocent person. We push those thoughts down and go to our work. We follow the evidence, go above and beyond. We hope she doesn't suffer, but if she is to survive we will make sure she has the best shot possible. After a few days the infection began to set in. All that dead tissue was basically a breeding ground for all kinds of nasty bugs. The first thing we noticed was the smell. I'll spare you the details but trust me it was bad. The only thing you can really do to encourage healing at that point is use an IV and topical antibiotics and debridement. Basically, large wounds heal better when they are scraped or shaved to expose the wound bed. This removes dead cells which prevent growth and encourages new skin formation. It takes weeks of treatments. This is already an unpleasant process for a small burn and wound. We had to do this essentially all over her body. We had to scrape her burned skin raw everywhere. Multiple times per week. Anything dead had to be removed. I remember a particularly nauseating moment when I was trying to gently scrape around her fingernail to save it and the entire tip of her finger, nail included, pulled off with some dead skin. By this time the infection set in hard. Multi-organism, resistant, fungal co-infection, you name it. The fungus was the worst part because it just ate away at her exposed tissues. We would debride an area and the next week it would be full of little pockmarked holes. Those holes were full of cheese-like fungus and they burrowed down deep. To the point where after you cleaned the fungus out you could stick your finger in the hole and feel the slippery connective tissue overlying the muscles below. You could literally touch the muscle. We spent hours digging out those little holes down to the muscle. All over her body, her legs, her back. That day I said out loud in the operating room, "This is the worst thing I've ever seen in my life." Several years in medicine later that statement remains true. That same day a surgical resident sat with me at lunch and we both broke down. He said this was all cruel and pointless. She would probably die from the massive infection and this poor patient suffered these weeks for nothing. This is the only time I've ever heard the lead surgeon say, "It would have been better if they didn't come out of the fire that day." She survived the next few days, and we started with the skin grafts. Trying to rebuild her face, and cover her body. Grafts would regularly get infected and have to be peeled off. She needed so many grafts we gave up suturing them in place and began stapling them in place. Her average time in the operating room was about 10 hours per procedure. Of course we have to keep the operating room at 98 degrees because burn patients go hypothermic quick. So imagine spending 10 hours on your feet, working with your hands in full scrub gear, in a nearly 100-degree high humidity room. It was brutal. I try not to think about what it was like to experience this. The patient could communicate by pointing with her eyes. She could speak a little bit too but not much. With no unburned skin to lie on, she had to lie on her back with her dressed burns touching the bed. She was mostly immobile. So she just had to lie there in pain for hours and hours wrapped up in these itchy dressings over her burns. She had no eyelids and couldn't blink or emote as you would expect a human to. She had no lips and couldn't close her mouth. She didn't look human. It terrified me and for a while I hated myself for feeling that way. I rotated out of the burn unit not long thereafter. Last I heard she survived and went home after 4 months. She really wanted to live I guess. She was much stronger than I am. Oh and the rotten cherry on top of this crap sundae? The driver of the vehicle survived with a moderate leg burn. He spent a week in the burn unit and went home. He was in the room next to her. Her sister almost needed to be admitted to the psych ward because the situation messed her up so bad. Her dog did end up living. She threw it out the second-story window down to her sister that day before disappearing in the smoke. This story still messes with me hardcore and I can still see it when I close my eyes at night sometimes.